How can we recognize the kidney failure or any kidney disease? Normally, the kidneys have enormous reserve capacity. So, unless the kidneys are damaged or they are not working by more than 75%, the person may not get any symptoms. So, that's why it becomes very difficult for even doctors also to recognize the kidney failure or kidney disease in its early stages. The kidney failure is normally divided into five stages 1, 2, 3, 4, 5 based on the GFR or the level of kidney function. Stage 1 is an early kidney disease, whereas stage 5 means end stage renal disease or last stage of the kidney or when the kidney function is less than 15% of the function. The symptoms of kidney failure in the early stages may be very vague and they may not be related to the kidneys. In the early stages, the person may have loss of sleep or he may not be able to get sleep properly or he may be getting up early in the morning because of lack of sleep. Concentration, he may not be able to concentrate on his work. And there are higher functions like memory. He will not be able to remember the things properly. He may say, Doctor, I have forgotten my wife's birthday yesterday, so there was a lot of problem. So like this, these symptoms may be very vague. So they may have anorexia or loss of appetite. They don't feel like eating and they may not know the taste also. So the patient may say, I am eating my food but I don't relish it. The taste is not there. So he'll say like that. So these are the very early symptoms of kidney failure. And as it progresses, the person can develop vomitings. Because he is vomiting, he may not be able to take nutritious diet and he may lose weight. So the patient may lose about 4 to 6 kgs in about 6 months. So as the disease progresses, the symptoms pertaining to the kidney may appear later. So they are like, for example, a patient may be passing blood in the urine. The blood may be mixed with the urine or at the end of urination he may pass a few drops of blood. Sometimes the patient may be having frequency of urination. So a person goes to the bed and he says, Doctor, I am getting up 10 times in the night to pass urine. So my sleep is getting disturbed. Some of the patients may have less urination also. So he may say, I passed urine in the morning, but till now in the evening I have not passed any urine. So there may be less of urine for some of these patients. Some patients may have difficulty or straining of the urine. So when he goes to the bathroom, he will not come outside for at least 5 minutes. So these are the symptoms which are pertaining to the kidney. Another important symptom in patients with kidney disease is high blood pressure or hypertension. Especially if we see high blood pressure in a younger individual, then definitely one should suspect that the person may be having a kidney problem. For example, I have seen one girl about a month back. She was about 15 years old. She came to me with a high blood pressure. So her general practitioner was treating her with BP tablets because her father was also having high blood pressure. So he thought it is a hereditary blood pressure. But when we have done the kidney function test, we came to know that that girl was having kidney failure. So it's very important in a young patient to suspect kidney problem if they are having high blood pressure. Another feature of kidney problem is swelling of the body. They may have swelling of the face in the morning or they may have swelling of the legs in the evening. So when you apply a pressure over the legs, a small pit may form and this may be a sign of kidney problem. And if the water is retained in the body more, then it can enter the heart or lungs and then patients may have breathing problem also. Another symptom of kidney disease is bone strength will be reduced because vitamin D is essential for bone strength and kidney is responsible for the activation of the vitamin D, and when kidneys are not working, vitamin D does not get activated and bone strength comes down and patients may develop fractures. Actually in children they develop what is called rickets. That means they may have bow legs and bony deformities may be formed in the body. Another symptom of kidney problem is anemia or lack of blood. When you look at the patient, he appears very pale. This is because lack of a hormone called erythropoietin, which is produced in the kidney. This hormone is supposed to go and act on the bone marrow to produce the RBC. When kidneys are not working, this hormone is not produced, so the bone marrow will not be able to produce the RBC. So these patients develop anemia.
For appointments, call 4959 4959.